Let's speak now with Dr. Jerryl Banait, Executive Board Member of the United Residents and Doctors Association. He joins me from Nagpur in the state of Maharashtra, where, of course, Doctor, you saw some of the biggest rises in cases in the last couple of months, and also quite a bit of politics as central government and state government argued over who was responsible. But what has been the effect day to day with the kinds of cases and the sheer volume of cases you and your colleagues have been trying to process?
Sean, the central government and the state governments are whatever the politics is going on, but the ground reality is that the medical fraternity and the common citizens are being affected hugely today. We are seeing a large number of surge and a huge number of patients who are coming in the hospitals for their own survival. And due to lack of oxygen beds or lack of ICU ventilators or ICU beds, we are unable to take them. Hence, we are starting COVID care centers where we are shifting the mild or moderately affected COVID patients so that the severely affected patients can be taken in the ICU setups and the institutions and the medical colleges. But the sheer number with which the patients are turning in the hospitals is tremendous, and the entire healthcare facility is stretched to its limit. Not just the doctors, but the paramedical staff, the nurses, everybody is exhausted, not just physically, but mentally as well. Because we see cases where there is oxygen is not available, where crucial medicines are not available. The vaccination drive is also starting from 1st of May. So we do not know where we are going right now. But fortunately, there are governments from abroad, like United Kingdom, has lent its hand and are giving us oxygen concentrators. And United States is also providing us raw material for vaccination, so which is a very welcoming step. And this will benefit the entire country and all the citizens in it.
And Dr. Banait, actually, just before we began speaking to you, the Élysée Palace announced from Paris, the French president's office, of course, as people watching may know, that it is sending 5 large containers of medical liquefied oxygen to India, but it won't actually arrive until next week. And all of this process we were seeing on Friday night, I think one of the major hospital chains, even the private sector as well, saying SOS, we are about to run out of oxygen. Reaction was done, immediate reaction where it was possible to do it, but you can't keep doing that forever, can you?
We cannot. I mean, the demand for oxygen and the demand for the beds is so huge that it has become practically impossible for the healthcare system to cater to the number of patients. And when there is a lack of oxygen, how can that be produced overnight? So we need help from abroad. We need help from all the entrepreneurs, all the philanthropists who can come in and give their support to the healthcare system today.
We know
because
that
ultimately it is...
I'm sorry to interrupt you. Please continue.
Ultimately, it is the citizens who are suffering. It is the Indian citizens who are suffering. The entire burden is on the healthcare system and the doctors. If we do not perform right now, the entire country will crumple down on its knees.
Let me ask you finally, I mean, how serious is that worry? Because we've had 5 weeks of continuing growth in the number of deaths. Sorry, I'm going to give you that again. 6 weeks in which deaths have gone up consecutive weeks. 4 weeks in which the number of infections has gone up in consecutive weeks. We keep record-breaking figures every single day. That might suggest that we have not yet reached the peak of this. And therefore, that means the problem is going to continue before it slowly starts to dissipate.
Absolutely. The peak is yet to come, I guess. And it might come after a few weeks or a month or two. We do not know. We cannot predict it because there is no stopping of the new positive cases. There is no plateauing. Every day, there are record number of cases which are coming in. And just in my city, which has around 2 or 2.5 million citizens, the number of cases which are coming positive is almost at 7,000 to 8,000. And assuming if only 10% of those require ICU beds, so the demand for ICU beds in my city is 750 beds per day. And how can we cater to that? There is limited staff, there are limited doctors, there are limited institutes, there are limited healthcare institutes in the city or in the country. But the cases are just increasing each and every day and each and every hour. So right now, currently, we are seeing one of the worst case possible in the history where such a huge crisis has come on our country.
Dr. Jerryl Banait, I know there'll be a great deal of sympathy in this country, but sympathy alone is not enough. Hopefully, international help is on the way, but we have a great deal of sympathy and respect for all the effort you and your colleagues are doing to try and help so many people, many of whom, of course, have family and friends here in the UK. Doctor, thank you very much.
Thank you.